Alright guys, this is Caesar with Nursing School Made Easy, and today's lecture is going to be on iron deficiency anemia. So let's jump right into it. Now remember again, these lectures are geared towards preparing you for your NCLEX exam. So the things that you need to focus on are your clinical manifestations and what will you be doing for your patient. What's the treatment? Let's jump right in, okay? So again, iron deficiency anemia. This may be due to inadequate dietary intake, some type of malabsorption problem, whether it's maybe a patient had some type of GI surgery or maybe suffering from some type of malabsorption syndrome. Another thing would be blood loss. And last but not least, hemolysis or hemolysis, depending on how you pronounce that. So let's focus on number one. And again, inadequate dietary intake. Now with these patients, you would tell them to consume more protein. Protein has iron, so your meats, you would tell them to increase the amount of protein intake, okay? Number two, malabsorption syndrome. So again, this would be due to some type of GI surgery. Maybe they had like a gastric bypass, something like that. Maybe they had a bowel resection. This would put them into the malabsorption category. Three, blood loss. Now this could be due to either maybe they had some type of surgery, hip surgery. A large amount of blood loss due to surgery will cause them to have anemia. The other thing is that we need to look at is something like GI tract blood loss or bleeding, such as problems with peptic ulcers. This would cause GI bleeding, gastritis, diverticuli. Okay, these may all result with GI bleeding, and as a result cause blood loss. Okay, that's what we're talking about in this portion here, in blood loss. And it would be due to the GI tract having some type of pathology. Now, for women, another form of blood loss would be through the genital urinary, or GU. And so this would be more important with, for example, periods during menstrual cycles. So you'd ask your patient, are they having any problems with their menstrual cycles? Is there any heavy bleeding? Because if they're bleeding heavily, this will cause, again, the anemia. And before we briefly talked about hemolysis. Things that you would want to focus on would be, for example, your malabsorption and your blood loss. Okay. Clinical manifestations. Again, make sure you know your core concepts. You know this for your NCLEX. This is what you will mainly be tested on. If you understand the pathophys behind it, the clinical manifestations just become that much easier. So you're having blood loss, like we talked about. You're bleeding out. If you're bleeding out, you will have, number one, pallor. You'll look pale. Now, a couple of things that set iron deficiency anemia apart would be something like glossitis. And this is just inflammation of the tongue. Number three, chylitis. This is inflammation of lips. Or because you have had some blood loss, you are anemic, you will most likely have decreased red blood cells. Decreased red blood cells means decreased oxygen. Decreased oxygen to the brain will most likely give you a headache. 5. Again, this goes again with the tongue. You'll have a burning sensation in the tongue. Now again, these are all due to iron deficiency. Okay. Now, diagnostic tests. Number 1, CBC. Now remember, in your CBC, you're going to have red blood cells. CBC stands for complete blood count. So in your complete blood count, you will have a number of your red blood cells. You will also have hemoglobin and hematocrit. You want to pay close attention to these, your hemoglobin. You can also do, for example, like ferritin, iron, but the ones that you want to focus on are your CBC, obviously your red blood cell count, hemoglobin, and your hematocrit count. Now, what would you do to treat, to help your patient out? Let's focus on treatments now. If the blood loss is severe enough, you will do a blood transfusion. Now this is typically if their hemoglobin falls below 8.0. But again, that will be determined by the physician. If the blood loss is not severe enough, or if it can be treated on an outpatient basis, the patient may be given oral iron. Okay. Now this is the least expensive and easiest way of all, really, just to take some iron PO orally. Now remember that the iron is best absorbed in the duodenum, or duodenum, however you pronounce it. Okay, just remember that it is best absorbed in the duodenum. That's why in the very beginning we talked about if there's a malabsorption problem, you will have problems with absorbing iron. Because again, the absorption takes place in the duodenum and the jejunum, but mainly in the duodenum. So if there's something wrong with here, or with the duodenum, you will have some problems absorbing iron. Okay? But we're on treatments right now, so let's get back to it. Again, oral iron, make sure that you understand that duodenum is the area that the iron will be absorbed. Now, this is important because you do not want to give enteric-coated or sustained released iron pills, because if they're enteric-coated or sustained released, they will not be able to be digested in the duodenum, and the iron will not be absorbed. Okay, so make sure you know that. Number 3, take iron, if it's PO, 1 hour before meals. Why? Because it'll be absorbed better if there's nothing in the stomach. Okay? So again, an hour before meals. And you also want to take it with vitamin C or orange juice. Again, the vitamin C and the orange juice are going to help absorb the iron that much better. Now, there may be some instances where they may be unable to drink pills. They prefer liquid. You can give liquid iron, but if you give liquid iron, make sure you inform them to drink the liquid iron with a straw. Why? Because iron will stain teeth. So again, you tell them to drink with the straw to prevent the teeth from being stained. Also tell your patient that iron will most likely cause heartburn, and a big one, constipation. This is very important if it's an elderly patient that you're giving instructions to. They may have some problems already with constipation. If they take iron, it's going to increase that. So with their iron, they may want to take a stool softener. You also want to inform them that if they are taking iron, that their stools may be dark. and that is because of the large amounts of iron that they're taking. Now also know that iron may also be given IM or IV. If it's given IM, make sure you use Z-Tract method to help disperse the iron. If it's IV, make sure you have a good IV site, and also that you watch out that they are not having an allergic reaction to the IV iron. So watch them closely, watch them carefully. Last but not least, that was number 9 and 10, you want to check and see if the treatment is having an effect on your patient. So at some point you are going to recheck the CBC, the RBC, hemoglobin, and